everybody. Welcome to this week's Jerusalem Connection Red Alert Report. I am your host, Amy Zewe. Today, our special guest is Aryeh Myers with Magen David Adom. You may or may not remember that is the emergency response services in Israel, and it is just a wonderful service, and there are people all around the world who support it and raise money for it and encourage the first responders. And we have interviewed those folks before. But today we have Aryeh, is a senior paramedic with the International Relations Department, and he is going to share with us a particular component of the emergency response service. And since the war, or maybe since before the war started, but this is something that you all need to know about and learn about and be able to connect with the needs of the people in Israel, the people that help the people in Israel, and learn how we can be supportive and participants in that effort. Aryeh, thank you so much for joining us. Tell us a little bit about yourself and and what you do for Magen David Adom and your particular role, and then we can get into identifying this mental health services component that is relatively new to the services.
So first of all, Amy, thank you. It's great to be with you. I work for Israel's National Emergency Medical Service. As you said in your introduction, Magen David Adom is the government-mandated organization that has to respond to all medical emergencies across the country. It plays two major roles. The ambulance service, so the EMS service is one, and the blood services for the State of Israel is the other. So we are the blood bank for the State of Israel. We provide the blood for all of the hospitals, for the IDF, to ensure that that's a different part of our life-saving capacity. As far as the EMS is concerned, thousands of vehicles, almost 2,000 ambulances and intensive care units, hundreds of motorbikes, and hundreds more specialist vehicles that enable us to respond to every single emergency that happens across the entire country. That's
Wow.
our main role, is what we're mandated to do in a slightly confusing manner. Whilst we're mandated by the government to do so, we're not actually funded by the government. And you mentioned us having supporters all around the world, and that's very true. We have supporters in the United States, in Israel, in Canada, in Europe, in Australia, all over, who help us do what we do, which is a critical component of resilience within the State of Israel.
Wow. And
Excuse me.
just to let people be aware and to debunk any myths that are out there, uh, the emergency services, as you mentioned, as mandated to respond to any kind of emergency, they will help anybody that is in distress in Israel. I was in Israel in November, and a Muslim woman, and this was in Jerusalem. She was hit by a train when she kind of jaywalked across the street. And I watched the responders. I watched someone on the motorbike get there first, and then the ambulance get there, all labeled with Magen David Adom. And then I watched this group of responders just without hesitation, respectfully, and with no prejudice or anything, attend to her wounds, tend to her safety. And I just want to put that out there because a lot of myths are rolling around in the West that there's some sort of apartheid or discrimination amongst Jews and non-Jews, and that is not the case. This mandate responds and helps anybody that is within the borders that is suffering. Is that correct?
That's 100% correct. But not only do we respond to anybody who needs us, the State of Israel has a big minority, right? About 20% of the population are not Jewish. They are Muslim Arabs and Christian Arabs and Druze, and from multiple different faiths and of no faith as well. And not only is the State of Israel comprised of that, but so is Magen David Adom. You will find volunteers and staff in the organization from every single one of those religions. I don't know who you were with in Jerusalem, but it's very, very possible to start your shift with an Orthodox Jew and a Muslim Arab working on exactly the same ambulance and responding. Sometimes it'll be a Muslim woman, and sometimes it'll be somebody in the Jewish areas of the city. And there are very many mixed areas as well, not just in Jerusalem. In Haifa, in Tel Aviv, you'll see a whole mix of everything and everyone. And you'll see those responders within Magen David Adom as well, and not just the people that we respond to, but actually the people we respond with. I never know who I might start my shift with, or what might be their mother tongue. They might speak Arabic, they might speak better English than I do, they might speak better Hebrew than I do, and it's anyone and everyone.
Okay, thank you for clarifying that. I just wanted to get that on the record because, like I said, there's a lot of misinformation out there about Israel, Israeli society, Israeli services, the government, etc. So tell us now about, and you can tell us the history and the progression. There is now an I don't wanna call it a new initiative, it might not be that new, but it's coming to fruition. The idea of when somebody calls and there's a distress, there's an issue, that it sometimes isn't just a physical ailment or injury or victim of a crime, but there's also a mental component of what people are feeling in terms of having a crisis and calling for help. Tell us what has been going on and how the mental health component of having some expert or mitigator on a team get implemented so that that's part of an emergency response, how they address it.
There are two main aspects to the mental health response that we're providing. Aspect number one is the response that we're providing for the general public, and the other side of that is the mental health response that we're providing for our staff and our volunteers. There's almost 40,000 people in Magen David Adom, 90% of whom, 90% of whom are volunteers, and we want to be able to provide the response that everybody needs. And mental health has become a much more recognized issue over the last few years across the world, across the Western world in particular, and in Israel too. And over the last 5-6 years, we've seen a lot more need for mental health response, whether that's due to having lived through a pandemic, whether it's due to the fact that we've had an ongoing war for almost 3 years in this country with different waves of that war. We have to make sure that we are able to respond to whatever's happening. We're seeing a lot more calls for mental health crises. We're seeing a lot more people suffering with symptoms like PTSD, complex PTSD, even just more anxiety calls, a lot more on the mental health front. And we want to be able to respond to that a lot better. So there's been two main initiatives. The one where we're working with the general public, responding to these mental health calls in the public, has seen a pilot program where we have trained paramedics to provide extra mental health support whilst having mental health professionals along with us, either in the vehicle itself that's responding or online, and who are able to help and guide and provide a much wider, much broader treatment to people who are suffering an acute mental health crisis, which is what we're seeing a lot more of. So we have doctors on call, psychiatrists, social workers, etc., who are able to help our paramedics respond on the front lines, rather than what we were doing in the past, which is basically putting them in the back of an ambulance and taking them to a hospital and kind of, I don't want to say washing our hands of the case, but we didn't have a huge amount of treatment that we were able to provide. Whereas with this pilot program, we've expanded the training that our paramedics are receiving. We've expanded the scope of the practice that we are able to provide. And we're doing that along with the Ministry of Health, along with mental health practitioners who are much more available and much more involved with the calls in real time. So that's as far as dealing with the general public. And as far as dealing with our own staff, EMTs and paramedics are also humans, and we all react to what we see, and our staff and our volunteers will see in one day multiple things that some other people, the general public, may only see once in a lifetime. And that's something that we have to be acutely aware of. We've seen, again, going back to COVID, that also led to a rise in mental health issues, both amongst the public and amongst our staff. But particularly over the last almost 3 years, with the ongoing war and the fact that we are responding to some horrendous sites and doing so under the ongoing threat of missiles. We'll be sent to a scene, we'll be treating people, we'll be rescuing people, we'll be evacuating them from buildings that have collapsed. And whilst we're there on the scene, there'll be another rocket alert. And then the reality is that our staff have to continue doing what they're doing. We know that we're sending people out onto a front line, which may not be battle lines, as it were, where the army is, where the IDF are fighting, but it's very much battle lines as far as reaching the patients we need to reach, seeing scenes of devastation, of destruction, of people who are very, very severely injured. I'm sure you've seen the images of the damage that these Iranian missiles, you're talking about 1,000-pound warheads, and when they strike an area, you're not just seeing localized damage, you're seeing blocks in any direction. where you could potentially have people who are injured. Obviously, the closer you are to the epicenter, the more significant the damage is, the more serious the injuries we will see, and the more people are likely to be killed. What we have seen, thankfully, throughout this war is that those people who have been seeking shelter in bomb shelters, in blast-proof rooms, so we've been seeing the number of people who have actually been critically injured and those who have been killed has luckily been much lower than we'd anticipated.
Right.
Certainly for those who are seeking shelter, following the guidelines that have been given out by the IDF has what's known as the Home Front Command, which is the part of the IDF that is responsible for the civilian population, and they have guidelines of when to seek shelter, how long for, and where. Thankfully, the population has actually been following those guidelines. Nevertheless, we have still seen hundreds and hundreds of people who've been injured. Many people who've unfortunately been killed as well. And that obviously takes a toll. It takes a toll on the people who are responding to these sites. And because often the sites are in sort of the same locations, then it's often the same team members who are responding. It'll be the same EMTs and the same paramedics who are responding multiple times to similar calls. And that in itself also takes a toll.
Yeah.
So we've built a system there as well, to ensure that we're able to respond to these people. I'm sorry.
It's amazing to me, and I recognize and I have recognized that the people providing the the services, mental health and otherwise, are also in need of a way to decompress and process everything they look at or see every day or every week, just as you mentioned, because it is beyond the scope of what sort of your normal person might encounter every single day. What I was going to ask is, as this pilot program was sort of rolled out, was it something that was done across the entirety of Israel, the north, the south? Is there a particular place where there's more need or less need? Can you tell us a little bit about the whereabouts so that we can be thinking about, praying about, and also as we consider our support to offer that support, which we want to do, that we know that we need to keep the North or the Gaza envelope or Jerusalem or Tel Aviv? Can you give us some feedback on how it was rolled out, where the needs were more concentrated or less concentrated, and the success of the plans that have been implemented?
So the pilot program that we started doing for the general public actually started in central Israel, so around the Tel Aviv area. It's slowly spreading from there. It is a process that's still ongoing. As far as looking after our staff, though, it is something that we have done nationwide.
Very good.
The reality is that if you were to listen to the news now, what you would hear is that there's a ceasefire, right? The Iranians are not firing missiles at Israel, so there's a ceasefire. But the reality is that if you go to the north of Israel, what they are experiencing and have been experiencing over the last days and weeks in this so-called ceasefire is that multiple drone attacks every day, rocket attacks. The civilian population that is living there is still very much in a state of war. And that means that our people who are there on the stations, staying in the area, responding to those who need us, are also still undergoing this incredible trauma. If you go back to October 7th, 2023, undoubtedly the people who needed us most were in sort of the southern part of Israel, around the Gaza envelope. But that changed already from the following day, from the 8th of October, when Hezbollah in the north joined in the hostilities. It extended again when Iran started firing the ballistic missiles. This is a nationwide crisis.
Mhm.
This is a nationwide need. And concentrating, I think, on our own people is something that we hadn't really done particularly well in the past. It was partially our own fault because we put on this uniform and feel like it's a bit of a suit of armor and we can see everything and deal with everything. And the reality is that we then go home to our families and we go home to kind of almost normal life, but very much bearing this burden. And I think the recognition over the last, I would say, certainly over the last 5 years in a significant way, and obviously even more so since the start of the war, so over the last 2.5, almost 3 years, seeing the importance of looking after the staff who are dealing with all of these calls is critical. And there's a whole system in place that allows us to do it. And it starts at a very, very basic level, because the person who understands most what I have experienced And what I've seen and what I've dealt with is not the people who are living at home. It's the people who I'm on the shift with. It's the people who work either with me in that moment or with me in a larger sense. So people who work at my station. So we start by debriefing just amongst ourselves. And that already is a step towards prevention of any long-term effects, of any PTSD effects, any complex PTSD, the really long-term, really complex issues. The first step to take towards doing that is learning how to debrief. And even before arriving at the call, saying, okay, this is what we're likely to see. These are the things we are likely to deal with. And then arriving on scene, dealing with what we need to do, which again, the vast majority of cases, people will turn up on scene and they will do what has to be done. It is exceptionally rare for someone to freeze and not be able to do the job they need to do because of something that's happened in that moment. But what does happen sometimes is that there will be a reaction. And if we see over the first 2 or 3 or 4 days that there's been some sort of reaction, we'll look at that as a normal reaction to an abnormal event. And that's okay. And that's fine. The fact that I'm trying to kind of push it out of my mind and I don't really want to talk about it too much for the first 2 or 3 or 4 days, that's normal. But if it starts stretching beyond that, then I have to start considering where this might go, how it might develop, and how I can prevent it from developing into something much more serious. And then again, there's systems in place. So we'll start off with that debrief because that will hopefully prevent even the first initial reaction. Okay, we don't want to say that that you shouldn't react in any way, because that is also not a natural reaction. There needs to be some form of understanding of what you've just experienced and having a bigger understanding. So if we're talking about one of the big events in Beit Shemesh, there was a missile that struck a synagogue and unfortunately 9 people were killed and dozens more were injured. And I wasn't at that scene, but the scene itself wasn't just where the missile struck. It was much wider. There were people spread over a large area. And if I'd have been at the scene, I would have seen just one little part of that picture. And I would have understood just one small part. And that actually potentially leads to more of a problem of dealing with what that situation was, because I don't understand the global story, what really happened there. So what we will do in these sorts of cases, we will gather all the teams that were there. And this was done on that day, just a few hours after the incident had ended. We gathered everybody who was at that scene so that everybody could talk about their perspective. What did they see? What did they do? What did they experience? How quickly did they get to hospital? All of just the basic details, because by filling in those gaps, by filling in those holes in what I know or what one specific person will know, that helps give a much clearer picture of what the event is, and that helps us understand and deal with the situation as a whole. And that really is that's the first steps of prevention of any sort of long-term reactions.
So that's amazing that that was recognized and an actual plan implemented to help everybody reconcile the chaos that they might have viewed. I understand what you're saying is these professionals, these staff members, maybe it's also volunteers of special training, they are so professional that they will get the job done in the moment. There's that's clear, but then they have to decompress it all at the end of their shift or the end of
Right.
their day. And you mentioned something interesting about trying to get ahead of the PTSD and the long-term effects that people then bring home to their families. And I'm thinking about just very as an analogy, like US military members, they might be deployed. So they're away for 2, 3, 4 months. They're away from their community. They're physically separated from their home, their family, their habitat. And then they come home. And that's a little bit different because your staff and volunteers, they're responding oftentimes, I would assume, in their own city, the place where they live, and then they're going home to their own families on that very evening or morning, whatever their shift may have been. What has been, from your perspective, the feedback from the staff and volunteers that are working through these processes and engaging in these steps to process and reconcile what they're looking at and be able to, I guess, live with it, right? And function with these abnormal situations they witness. Are you getting data back or feedback about how it is really helping the staff and volunteers?
So the specific numbers are still being crunched, but we are getting feedback from people to say that they feel that they are much more able to cope with the situation, and they also know, more importantly, that they have somewhere to turn should they need to. So again, whether that's starting just as with your own little teams, or the two or the three or the four of you on the ambulance, whether that's a wider case. And if not, we've also set up in every region of Magen David Adom, we've set up a number of people who are an initial point of contact for someone who feels like they need the help. And it works in both directions. Someone can approach them for help and say, listen, I've been struggling with whatever this call was. And the call that might bother me might not bother someone else at all, right? I might see a horrendous call and be absolutely fine with it, but the person I'm working next to might be struggling with it. So there is the option for them to approach one of these extra trained members of staff and say, I need some help. But the flip side of that is that these same members of staff who've had this extra training and given this additional role are also proactively going out to the teams to say, we've heard the dispatch room highlighted, red flagged a call to say, listen, this sounds like it could have been a particularly bad call. Maybe you should follow up with the crew. And so they will be proactively going out to check to see that everybody's okay, and they'll come back and do it a few times.
Wow.
And if we see that, again, once we get past these first few days, that someone needs extra help, then we're able to refer them to social workers, to psychologists, to people who, under normal circumstances, are very difficult to get to see at the moment, especially at the moment with this huge
The
increase in the
volume.
mental health
Yeah.
needs. But we have people who work specifically with Magen David Adom, who understand what it is we're experiencing, that are able to respond much, much quicker. Usually within 24 hours, we're able to get additional help from the outside, from these social workers, from these psychologists, if we assess that there is a need for it, or if the person has approached us and said, we really need this extra help. So that
Yeah.
system it really is, we're getting a lot of good feedback from that, to say people are appreciating the fact that they know that there is somewhere to turn, they know that there are people to turn to, and we have on every and one of our ambulance stations, and in our dispatch rooms, we have signs up saying, scan this QR code, um, and it can all be done very anonymously. You can, if you decide you don't want somebody who lives or works nearby, you want to take that one extra step, you can approach anyone
Mm.
across the country who's in this role of dealing with mental health issues, and say, I really need this extra help. I don't want my local
Mhm.
team to know about it. It's absolutely fine. As long as you get the help, we don't care who you get the help with.
Right.
We just want to make sure that we're able to look after you on a global scale. So if we need to do it, but we've got a system in place that helps us do it.
That's wonderful. And I'm assuming that as this program expands and the feedback is, increases, I'm sure the family members of all these staffers are also ultimately going to benefit, that they can have their father, their mother, their sister, their brother, whoever it is, come home and be able to better cope with what they had to endure. And that makes for a better family situation and, just your community everyday life. So it's really a beautiful thing.
Absolutely.
If I can shift gears just for a moment and kind of ask that same question from the public side. So as you are implementing a program where the paramedics, the responders are either trained directly on how to de-escalate or mitigate or work through a call that's about anxiety or some mental health call where you're not just putting the person in the ambulance where they still might be panicked and upset and disoriented and getting them to the hospital. By having that training for the actual members of that response unit or online access to folks that can help them talk through, has there been any feedback on how that has affected the general success of I'm gonna say the success of the call, but the idea of getting that person from the telephone when they called in all the way to the hospital or wherever they may need to go, has that helped everybody, whether it's the paramedics themselves, deal with this person with now some knowledge on how to deal with it, and the response of that person who's asking for the help, not just being treated in a physical way, get in the ambulance, get to the hospital, but having somebody help talk them through. I'm assuming it's a lot of I'm not a mental health expert. I've never taken courses in it, but I'm assuming it's a lot of mitigation, verbal mitigation on how to help people just sort of de-escalate the panic or anxiety that they're going through.
It First of all, it starts with recognition. The majority of the calls that we receive for someone in mental health crisis actually doesn't come from the patient themselves. It comes from a member of the family, a friend, somebody usually in their immediate circle that realizes that something isn't right. It does sometimes come from the patient themselves. We do get that as well. And I think having these extra skills is important. Having the extra options of treatment is critical. Because if once I would be, I'm a bit loath to use the word, but I'm going to use it anyway, if I was fighting with a patient to get them into my ambulance so I could get them to a hospital because I didn't really know what I could do with them, I now have extra options, whether that means bringing out a mental health crisis team to their home to be able to kind of deal with it there. Again, we're, as paramedics and EMTs, we're not mental health experts, but having that extra training and having those extra options available to us, I think makes us better clinicians. I
Mhm.
think it means that having extra options for these people means that their reaction is eased and they feel like they're not being forced into doing something that they don't really want to do. Very often it'll just be all they need is someone to sit and talk to them. That's what they need. As an emergency service, we can do that up to a point. But the reality is that my intensive care unit needs to be dealing with more than just one patient over 2 or 3 or 4 hours or whatever it is sometimes. And sometimes the answer really is just getting them into a hospital so that they are in a safe place. Sometimes it's getting them directly into a mental health unit, which is something that we couldn't always do, and now we have a lot more option of doing. Again, so you're taking them directly to the specialist in the same way that I take a heart attack patient directly to a cardiac ward, and the same way that I'm taking a stroke patient directly to a stroke unit. I want to be able to take these mental health patients directly to the experts in that field, and that gives them a much better chance of recovery, and it gives us a much better chance of being a lot better at our jobs.
Well, exactly. That's what I'm thinking. The success then for both the folks, the family or the individuals that called for help, um, and your staff to say they feel good about, okay, we successfully did what
100%.
we need to do, and
Absolutely.
do it efficiently. So how can people learn more about Magen David Adom? Is there a website we can go to? Where can we learn more about it, contribute, just really participate in these efforts in helping you expand the programs that are offered in this mandated services that really is a lifeline for all Israelis, everybody in Israel.
So to learn a bit about Magen David Adom and about the work we do and to be able to support us, if you have a look at a website called savinglivesinisrael.org, savinglivesinisrael.org, that's the website that will give you a lot of information, a lot of understanding about how the state of Israel really works, going right back to the beginning of when we started talking about the realities of what the state of Israel looks like. And those who have been here know it. You walk down the street and you will see members of every single religion and none, and coexisting. And that is very much true of Magen David Adom as well, which I look at it as a microcosm of what the state of Israel is. You can be doing a shift with someone who came here from Russia in the 1990s, or somebody who's lived in Jerusalem for 10 generations. And people from all over the world and from all different religions working together to do one thing, and that is to save people's lives. And even if not every call that we go out to is a life-saving call, it is always life-changing, because the people who call us because they need somewhere to turn, and we are the people that they turn to.
Well, we are grateful for all that you're doing, and we definitely want to learn more and help participate in those efforts. So we will be sharing that website for sure. Arya, thank you so much for sharing these insights with us. Our
Thank
audience
you very much.
needs to know the truth. They need to know the particulars. They really want to pray and support all of Israel, everybody that lives there, in this time of need, in these difficult times. And so we're very grateful for your time and everything you're doing. Thank you so much.
Thank you very much. Thank you for having us here.
You're welcome.
Yeah,
Shalom.
take care.
If you enjoy these conversations, please visit us at www.thejerusalemconnection.us. Find all our podcasts on YouTube or wherever you listen to your favorite podcast program. Follow us on social media, subscribe, like, and share our content to reach the broadest audience.